Good morning. Today is April 21st, 2020.
Seats, please.
In them.
Good morning. I'm Charles Cooper, and I'm here to talk to you about managing diabetes. In this informative speech, we will talk about the several different methods to manage diabetes which have advanced as technology has. By a show of hands, would you knowingly inject poison into your body?
No.
If no is your answer, then I agree with you. If you don't manage diabetes, your blood sugar becomes toxic poison and can cause serious short and long-term effects on your entire body. According to the CDC, an estimated 34.2 million people have been diagnosed with diabetes. That is roughly 11% of the United States population, according to the CDC. Initially, pills were the most effective way to manage diabetes. As technology advanced, the methods have evolved. First, let's talk about the most prescribed method of diabetes management, metformin. Metformin is an oral diabetic medicine which is used to help treat and control blood sugar levels caused by type 2 diabetes, which I found in WebMD. However, it is not insulin. Metformin can be used in conjunction with diet and exercise to help patients. Metformin can also be used in conjunction with insulin. 57% of diabetics take an oral medication like metformin to manage diabetes. Some of the myths about diabetes is not all patients respond to oral medications. Another method for blood sugar control is insulin. When you hear the word insulin, do you cringe with the thought of poking yourself with a needle? It's not as bad as it sounds. With the use of tiny needles today, it is near painless. It's needles such as these. If you take a moment and pass that around. Insulin therapy is an alternative solution for getting your blood sugar under control. There are no insulin pills, according to the ADA, the American Diabetes Association. Insulin is a hormone made by the pancreas that allows your blood to use sugar from the foods that you eat as energy. Here I have a small vial of insulin, as you can tell, clear liquid. Ordinary when you look at it, but insulin has to be broken down by your digestive enzymes. Therefore, it cannot be taken in a pill form. Instead, it must be delivered in an injection into a layer of your skin, normally a fatty part, such as your belly, the back of your arm, or your buttocks, or some of the more common places to administer insulin. Type 2 diabetics don't typically start out needing insulin, but a very large number will progress to some form of a shot for different reasons. Without proper care, you cannot manage your diabetes without medicine. Type 1 diabetics will often require more than one injection per day. And that's really contingent on the type of insulin and how you maintain your blood glucose level. Do you know what glucose is?
Yes, it's sugar.
Yes, glucose is another name for blood sugar. And its levels determine the amount and frequency of injections needed to control your glucose levels. As I said before, injection sites may affect the level of insulin absorption. Common insulin injection sites being the belly, the stomach, the thigh, the buttocks. For optimal effects, it is recommended by the American Diabetes Association to take quick acting insulin at least 30 minutes before you eat so that insulin can get into your system and begin to work, and give you a long-acting insulin before you go to bed at night. Although there have been technological advances in administering insulin, the oldest and most commonly prescribed is a syringe. The needle sizes have been made smaller to manage penetration pain. As you saw by the needle that I passed around earlier, you saw it was smaller than a pen. Insulin pens contain a cartridge filled with insulin can easily be discarded after emptying. Here, a Trulicity pen, a maker of, and insulin pens got their names because they look similar to a pen and easier to carry around. So if you take a moment to pass that around, you guys will look at the insulin pen. As you can tell, the dosage is dialed in on the pen and is administered through a needle, similar to using a syringe. If a person needs 2 different types of insulin, they carry 2 different type pens around and get themselves in 2 different injection sites. A pro to using this method is that they are pre-filled and it's easy to carry around and administer, and it doesn't need to be in the fridge, according to the American Diabetes Association. Current technological advances have created several options for administering insulin and may offer a more different and faster way of managing diabetes. The insulin pump. This is an OmniSwitch. If you take a moment to look at this OmniSwitch, it is an insulin pump, and it is the final method I will talk about today. Insulin pumps are the new age of administering insulin. Insulin pumps are small, efficient, and computerized. The insulin is administered at a steady and continuous rate, which they call bolus, and it is used to monitor blood sugar levels as the technology advances, these pumps administer continuous insulin and monitor your glucose. Although insulin pumps seem to be easier, they still require proper management and commitment. In conclusion, insulin is a hormone made by the pancreas that allows your body to use 2 different sugars. There are several methods to manage diabetes, and some forms seem as simple as diet and exercise. Although this may sound easy to manage, many Americans don't take it serious, and it results in life-changing habits that can't be reversed. Thank you, and this concludes my speech.